Okay, so welcome everyone and to our data science in stratified healthcare and precision medicine hangout. And I'm Minhong Wang. I'm a teaching assistant for this course and have been supervising our discussion forum. And can everybody introduce yourself, Arati? Oh, you're muted, I think. Sorry, you're muted.
Of course I am. Hello, everyone. My name is Arati Manataki. I'm the course organizer, the course lead for this free online course on Coursera. I'm a teaching and research fellow in the Centre for Medical Informatics in the University of Edinburgh, and anything health data sciencey kind of turns me on. So here I am.
Yeah, and we are very happy that we have an NLP expert joining us today. And Honghan, can you introduce yourself, please?
Sure. Thanks, Minhong. Hi, everyone. My name is Honghan Wu. I'm a lecturer based in Institute of Health Informatics at University College London. So my background is computer science. As Minhong said, I have been doing a lot of technical NLP, natural language processing, for the last 5-6 years. So my PhD actually was so-called knowledge graph technologies. It's kind of using semantic web. If some of you know about semantic web, it's kind of using logics to do some kind of human-like inference to capture domain knowledge. So we might touch a little bit about that in today's interactive sessions. Yeah.
And so in this hangout, we will provide a course recap from Arati to talk about what have we seen in this course and what are we going to talk about in next few weeks. And then we can have an interview with Honghan and ask some questions and get some insights from Honghan. And also finally, I will quickly go some questions we got from the discussion forum. And so, yeah, Arati, can you please provide the course recap, especially with more details about NLP, since we have an NLP expert today?
Absolutely. So also for your reference, Honghan, this course aims to introduce people to data science in stratified healthcare and precision medicine. So we provide an overview of a range of techniques in data science and demonstrate how these are applied in healthcare and medicine and how these are transforming the field. So from a technical point of view, we look at things like medical imaging, we look at machine learning, there's obviously natural language processing as a topic. We also look at graph data and process modeling and lots of other methods. And on week 5, which is the last week of the course, we make a case about how challenging, but also how important it is to bring all these diverse data sets together and employ appropriate methods to get value out of this data set. So each week we look at different topics, basic concepts, and then sometimes a bit of hands-on practice using Jupyter notebooks. So in the course we use Python. And in terms of natural language processing, we first of all explain how important it is to extract information and knowledge from clinical text, and we use an example of a pathology report. And then we move forward to discuss different types of natural language processing tasks, both low level and high level. So this includes sentence boundary detection, so how you can use computational methods to identify that this is a sentence and that is a sentence and so forth. Tokenization, so identifying different parts of text as in words or punctuation symbols. We discuss part of speech tagging, for instance, to differentiate between noun phrases and verbs and adjectives, which for humans is fairly easy, but for machines perhaps not that straightforward always. We look at morphological decomposition, shallow parsing, problem-specific segmentation, and other techniques. So not at great depth, but hopefully what we're aiming to provide is a comprehensive understanding of the breadth of techniques that are out there and what one can do to analyze text using computational methods. And in terms of computational methods, we distinguish between rule-based approaches in natural language processing and more machine learning informed approaches. And I think this is pretty much it. We also have a hands-on activity related to natural language processing, which is fun. You can see how you can get a Word document and analyze it using appropriate packages in Python.
Yeah, yeah, we're very happy to have Honghan today, and we have collected some questions from a discussion forum in advance. And so we will go through some questions as also the questions we have collected before. And firstly, can you give us a brief introduction of your research area? And I know you have talked a little bit before, but can you give us more details and also maybe talk about one project you have joined recently? I found it interesting to share.
Yeah, sure. Thanks. Thanks, Arity, for introducing the background about the course. I think it seems you guys have been learning a lot about NLP already. So it's very fun, yes, to use a different technology. And the Python actually do have many packages to have this hands-on experience very quickly. Yeah, in terms of my my background, I already briefly introduced. So my background in computer science, so-called knowledge graph. It's called knowledge graph now, but at that time it's called semantic web. It's more about using present domain knowledge in kind of computer understandable way, like associations between different entities, and also some rules behind them, so that computer do some inference. And I started doing clinical NLP about 6 years ago, 5 or 6 years ago, when I started my postdoc at King's College London. And that's the first time I actually encountered loads of free text data at the hospital in real world. And I worked with colleagues at Hospital South London Maudsley, looking at so I original plan was to using knowledge graph because my background is computer science, as knowledge graph, as I said. At that time, I worked with the colleagues at South London Maudsley, which is the largest psychiatric hospital in Europe. So you basically cannot create a knowledge graph from their data EHR there, because loads of information in free text. So without using NLP, actually there's no knowledge graph available for you to build up. So NLP is the first step, a very key step for that hospital. So that's that. Yeah, that's basically my journey started in terms of NLP, clinical NLP, for my kind of personal experience from that time, that particular project. So Minghong was asking about one particular project I think I would like to share with you is, so when we developed this NLP project at South London Maudsley, we were contacted by a general hospital in London as well, just across the street, called King's College Hospital. They do have a project funded by UK government. It's called Genomics England 100,000 projects. Basically, that project look at patients with rare diseases. So the patients with rare diseases to look at basically, the phenotypes they have, the treatments they had, the outcomes they had. So you collect information from different hospitals, so you have enough number of samples to do this kind of genetic phenotype association study or some many other studies. So what they needed to do at that time is that they need to look at these potential patients to be recruited for that study. They hired, I don't remember how many, maybe 6 to 7 research nurses to read these clinical notes to see whether the patient had these phenotypes or not. You can imagine how time consuming that would be. Look at hundreds for one particular patient, the hundreds of notes. For one disease, rare disease, they have 15 to 30 phenotypes you need to look at. And it's very time consuming process. And they were thinking whether we can somehow to represent clinical notes, highlight this relevant piece for these clinical nurses so that they can do their job more efficiently. So they're not asking us to provide the answer directly, but kind of using NLP as a tool to facilitate this kind of phenotype identification problem. So we did that project was then, what we did is create the user interface at the back end is kind of using NLP to identify these named entities. I'm sure in this course you learn a bit about named entities. Basically identify these entities in the free text, for some mentions of diseases like type 2 diabetes, for example, or drug use, like the patient on this drug. So then, if you can highlight those, actually these clinics can very quickly say, actually this is relevant to this phenotype I'm looking at. So they find this tool very, very useful, improve their kind of efficiency in terms of doing this project. So that's just one particular example. I hope, yeah.
That's a great example, and it just reminds me of one question from the discussion forum. Asked about reviewing the content NLP generated. If I get the question right, that we got an NLP to extract the data from the clinical notes, like what you said, and how can we review the content, the data it generated, to make sure that the data we generated is correct, or how is the accuracy?
Yeah, that's a very good question. And I guess the person asking this question knows a little bit about clinical data, or at least has some experience. So one of the challenges, very big challenges in clinical data science in general, not just NLP, is that you can imagine every single patient data in the hospital is incomplete. So we never have a complete picture of the patient. Some data sits within here, some data in the UK, for example, some data sits within the primary care, it's called GP in the UK. Some hospitalization data sits within the hospital. There are some national data sets which is not in very depth. You cannot have one single data set have every single information of a patient. That's why you need to combine NLP results with structured data. I can give you a very specific example. Let's say you look at patients with type 2 diabetes. You can imagine, okay, I can use hospital diagnosis data. We say, okay, data like ICD-10 codes, which specify the patient had these coded data somewhere in the hospital. We know the patient had type 2 diabetes. In reality, is that those patients have diabetes might not necessarily admit to the hospital because of type 2 diabetes. You might be able to do some inferences saying that the patient is actually on certain drugs, and these drugs only used to treat type 2 diabetes. So I can do this inference. And these drug use sometimes only appear when the patient visit the hospital in the GP referral letter. So you need to use NLP to pick up this drug use, combined with this diagnosis data. You see, okay, combine all this data together, we can identify 2,000 patients in this hospital at type 2 diabetes. Without NLP or without structured data, you might only see part of the picture. So that's the way you have to combine different data sources, different technologies together.
Yeah, and after we generated the data within NLP, so how do we make sure the data generated, is it like still reviewed by human, or how do we do it clinically now?
Yeah, that's a good question. So yeah, NLP, we can say you can never expect NLP to give you perfect result, especially in clinical domain. So what we do in our deployment of our tools in the hospitals or support clinical studies, we always create user interface to allow the users to validate the performance. We just generate random samples saying that, okay, you look at type 2 diabetes. These are all the cases we identified as type 2 diabetes. Are you sure they are correct? You can feedback to the patient, to the system saying that this is correct, this is wrong, this is correct, this is wrong. And when we do this feedback, they basically have the system generate performance. As you have learned, I guess, precision, recall, F1 measure, a score, basically give you kind of quantitative numbers about how good or bad the system is in terms of identifying these kind of conditions. Then the system can learn from the feedback, actually continuously improve using machine learning models, for example, improve the original version of the NLP model, better models, hopefully, in the later iterations. Yeah.
Yeah. And you were talking about, for example, in UK data sets, in different data sets, for example, GP data or hospital data here, that's why it will be very challenging to get a complete data, and we always have to deal with the problem of incompleteness. And
Yeah.
comes out one question from James, and he asked about what do you think? Talk about the challenges associated with using knowledge extracted from EHR in downstream data analysis. For example, when combined with other data sets, and in particular, what techniques can be applied to allow further analysis based on what could be an unreliable data set?
Yeah. Yeah. So more about two things, I think. One is data integration from different sources. The second question is about uncertainty in the data. So unreliable data, which means the data might have, some data quality issues. So, in my background, I always recommend using so-called knowledge graph because the technique is separate in computer science, particularly designed for this particular kind of data integration from different sources. And the reason using knowledge graph, I think, benefit is that using graph data structure, which kind of less schema focused, so you can be more flexible in terms of what kind of data can be integrated. You can always add new edge, a new link into your existing knowledge graph or graph data structure with new kind of associations. This makes this integration much easier. Also, in addition to this, there are many other benefits we don't have actually the time to tackle the benefit of using semantic web technology or knowledge graph in data integration. But that's the area you might spend some time to read if you really want to do some data integration. For data uncertainty, semantic web, because it's doing data integration from different sources, it actually considers this kind of uncertainty in your data. There's a technique called uncertainty modeling or fuzzy logic. It extends this kind of uncertainty in your data. And also in terms of statistic area, you do have this Bayes network, which kind of can represent the association between two things with probabilities. Let's say I'm 85% sure it will rain tomorrow. 85% is a kind of uncertainty. This kind of technology can help you to model these uncertainties, unreliable data in different data sources. This can be prior knowledge. You can model this based on these knowledges, or can learn from these data themselves to build these kind of networks with probabilities and these associations between different links between different entities. Yeah.
And just think about one question quickly. What if we get inconsistent data from different data sets, and how do we combine them?
Yeah, that's very good. So incompleteness and inconsistency. Inconsistency is two aspects, and semantic web also trying to. So the reason of have a logic-based approach is that technology can help you detect inconsistency in your data. But once it's detected, so that's the next step is how to resolve these kind of inconsistency in your data. So in many cases, you have to, in clinical domain, you have to have human to intervene. So I found something, for example, I have been diagnosis type 1 diabetes and also type 2 diabetes. As a clinician, they might know, okay, it's never, in most cases, the patient would not have both diabetes at the same time. And so, which is inconsistency. So, but you have to ask the clinical input, which data source is wrong, which one has kind of more, we should trust which data source more compared to others. Yeah.
Yeah. And just quickly want to say, like, if you have any questions for Honghan, please just post it. And also, we are from all around the world, and we are also all experiencing this pandemic. So I'm thinking about it will be interesting to talk about how can NLP help with the investigate COVID in this pandemic, and what's your personal views on this question?
Yeah, so we're doing at least two projects directly related to COVID-19. So one is quite similar to the first use case I mentioned, using NLP to facilitate data extractions from free text. We know that the clinical systems are struggling, are still struggling with the COVID. And one of the challenges is you have to populate high quality data for clinicians, for researchers to study these patients have had COVID, which is the best or better or effective treatment plans for particular patients groups. So for that case, they have to look at different sources of data, for example, imaging data, clerking notes, treatment outcomes, patient medical histories, have a kind of structured way so that different models can be applied, or clinicians can look at the data saying, okay, I think this patient should, under that treatment, which might be more effective. So what they are doing now in the UK, for example, in NH Lothian, actually, is near Edinburgh. So they hired medical students to manually extract this data as a spreadsheet from different sources. So you can, as you can imagine, actually NLP can play a very important role here, basically highlight all the relevant concepts to treatments, to X-ray and chest X-rays, identify these symptoms or kind of findings from different sources so that you can facilitate these kind of data extraction in a more efficient way, kind of semi-automated way to do that. And the other example project we're doing is with an NHS trust in London. So in addition to directly treat the patients with COVID-19, you also would like to identify these high-risk groups, prevent them to going out, so doing a lot of social activities, which might end up with having very kind of bad result because focus on patients who have diabetes or patients with older populations. They might end up with very bad result if we catch COVID. So it's called shielding in the UK. So you have to identify high risk groups. What we did with the NHS is that they identified 20 or 30 different physical conditions which might have high risk of deterioration if they caught COVID. So this is using NLP, basically reading all the nodes in the hospital, and then identify those patients which potentially would be kind of vulnerable for COVID pandemic. So we're using NLP to help identify this high risk as well. So this is another example.
Did you have any? Oh yeah, good timing.
So I have a question for Honghan, and it's a rather practical question in a sense. So we've been teaching our students that in any data science project, the biggest part of the work or the time that one spends is on cleaning the data, processing it until you bring it to the right shape and form to employ your clever algorithms. And I'm wondering, is there something equivalent in NLP projects? So I suppose cleaning is an issue and processing, but is there something very specific to text that one should keep in mind when embarking on a new project?
Yeah, certainly. I think very much the first very important steps to data cleaning and understand the data. Each clinical nurse in the hospital, they do have metadata, tells you about what the type of data is and what kind of template they used. Sometimes understand, just one particular example in terms of data cleaning is to understand the document structure. So I can give you a very specific example is that the work I mentioned with South London Moseley, which is a psychiatric hospital. And because it's a psychiatric hospital, people were worried about many things. For example, patients with depression, they're worried about their pets, or sometimes worried about their relative, worried about their parents, partners. So you can very often encounter a paragraph describing the patient's worries. For example, worried about my pet or might have diabetes. If you don't know this particular section is talking about some worries, you might end up with identified type diabetes, which is not actually the patient themselves. is their pets or someone else. So we might end up with very strange conclusions about the patients. And for those patients, and focus on patients with schizophrenia, we talk a lot about their dreams. So dreams and many things can happen. So if you put that in the context of real world situation happening to the patients, that might be a disaster as well. So this kind of data cleaning in terms of NLP, the first step is that you know what kind of data you're dealing with, even which section you're dealing with is very, very important. Yeah.
This is fascinating, Honghan. Thank you. I don't think I had ever thought about dreams being described in clinical text, and of course it makes sense. So distinguishing must be a real challenge. Very interesting.
Yeah, exactly.
Yeah. And one question didn't talked about from the discussion forum before. A question from Luca asked about, could you give your insights for imaging fusion, for example, MRI or CT with EHR leveraging on NLP?
Yeah, very good question. We do have a project look at we call it structured reports of imaging data. So essentially, as you can imagine, we do a test in the hospital. In addition to imaging data, you do have structured reports written by radiologists or sometimes clinicians in some clinical settings. So combine these two actually is very important because you have different sources of data. One is in the imaging itself, the other is clinical inputs from actually professionals, can be radiologists or be a clinician. And basically they read these reports, read these imaging, have some conclusions. Combine them is very important. I can give you an example. We look at stroke. So you know there are different types of strokes. As one specific stroke is called SAH. I don't remember the full name. Basically, it's one subtype of stroke. Look at the bleedings in the brain. If you only look at the imaging, you know, okay, there's bleeding across the whole brain. It's SAH. I can make a very quick. The AI model can make a very quick judgment is SAH. But there are some clinical criteria. Even this is a bleeding across the let's say the brain is not necessarily SAH because there are different exclusion criteria. One group exclusion criteria is that if the patient has got a traumatic event recently, which is the patient just banged their head, is caused by some extra force on the head, which is not SAH clinically. Or the patient has a tumor in the brain, which is not necessarily shown in the imaging, but the clinician might have some other sources and know the patient had tumor, which in this case is not SAH. So combine different sources is very important to have a correct, more accurate judgment of a patient condition. So that's very important to do that.
Yeah, thank you, Honghan. And I can see we have one more question from James to ask about are there any, we were talking about challenges before, and we also covered about the challenges extract data from downstream data analysis before. And one more question about, are there any healthcare challenges that might seem suitable for NLP knowledge extraction or knowledge extraction are actually full of pitfalls and in the end not suitable at all?
So the question is that, I'm not sure I actually understand the question. So just trying to rephrase it. So the question is more about which clinical problems is more suitable using NLP, which ones are not suitable for NLP. Is that the question? More or less, or I don't know.
I guess so.
I understand it.
Okay,
Yeah.
I try to explain, in that way then. So if you ask me, I would like to say, without NLP, given the current practice, at least in the UK, about 80% of the patient data is in unstructured format, like free text. The structure is a very subset of the whole patient data in the hospital, even in the whole health system across the country. So without NLP, you will not get a kind of more complete view about the patient. If you imagine you're doing a cohort study, you're trying to identify cohorts with patients with type 2 diabetes. I mentioned type 2 diabetes a lot because I support a lot of research with type 2 diabetes. So one particular example I saw some most again is that is psychiatric hospital. All the physical conditions like type 2 diabetes or CVDs is never coded correctly in structural database. So we only use structural database identify ICD-10 codes related to type 2 diabetes. We only get, and also join that with patients with depression, because that study looking at patients with both type 2 diabetes and depression. We only get about 20 patients in the hospital. But if you use an NLP, you might find 100 times more patients in that particular study. There's a big difference. You might argue that it might be just one because the hospital is a psychiatric hospital. You have structured data about the patient's physical conditions. But that's not the case. I would like to, as I said, about 80% of the data is unstructured across NHS in the UK, basically. Yeah.
Yeah. I think that's what James means.
Okay.
Yeah, and I think we got his comment. Yes, and yeah, it's very great to hear some applications about NLP, and it's very impressive that a huge amount of data sets actually there are free text data now, and we have not a lot of structured data in the real world. So it's really a powerful tool to apply in the real world.
Yeah, just remind me. Actually, we had a discussion recently. We invited NHS standardization lead at University College Hospital to discuss with my group in terms of applying the models we developed in NHS. So what she told us is that UCL just bought a very expensive EHR system called Epic from the States. So she's trying to push the clinicians to input the data in a more structured way, the drop-down list, click the SNOMED CT, the patient had this condition and that condition. But the clinicians in practice, they're very busy. They don't really like, input is limited. Drop-down list, you can only input this in this box. You have to select, you have to search. They are more tend to select very generic terms there and write their understanding in a free text form because they don't have time to just go play with your system. They just write things very quickly. So you end up even you have the world's best EHR system. The data input is still loads of in free text format. So you need to deal with free text anyway. It's not about the data structure. It's not structured better way. You don't have time to structure data in a better way so that you can apply. You have perfect data to apply data science later on. So that's the reality in terms of clinical practice, I think.
Yeah, good to know. And thank you for sharing some insights in NLP and also the applications. And do we have more questions? I think we have covered all the questions. And yeah, thank you again, Honghan, for joining us. And
thank you so much. I found the discussion fascinating. I've definitely learned a lot, and I'm sure the students have too.
Yeah, it's very informative, actually. And at the end, I just want to quickly go through the discussion forums, some questions, because we got quite a lot of questions focusing on Jupyter Notebook. And I just want to mention that we have instructions of Jupyter Notebook in week 1. It's a reading material. And also, there are furthermore Python resources in general discussion. Maybe we should ping up later. And also, I just want to say that we use Jupyter Notebook just because it's easy to sharing. And please feel free to use other platforms if you prefer. For using Python, you can use whatever you want. And yeah, for example, PyCharm or even VS Code, whatever you want. And also please feel free to ask questions on the discussion forum and help each other. And do you have more things to add? narrative?
No, I think we've covered everything. Thanks, Minghong, and thanks, Honghan, for this really fun and informative session.
Thanks.
I look forward to catching up with everyone in the course in the discussion forums.
Okay, great. Yeah, thank you, everybody.
Thanks, everyone. Bye.
Thank you. Bye. Bye.